Hello, everyone. Welcome. I am Dr. Allison Hull, and welcome to Well-Being. We are a tribe planted with purpose. And just as this picture depicts, this is why we do what we do. Our mission, our goal is to help people, families, relationships thrive. We want you guys to really learn how to live well and to live well long term. So I love this picture because our other goal is to truly impact all members of the family. And even if only you choose to join Well-Being, there will be a wake among your family members and everyone will benefit to some degree. So thank you so much for taking the time to watch this information session, to learn what we're all about, because truly you are a integral part in our growing mission to truly improve as many lives as humanly possible. I am a primary care physician. I'm a dual board certified internist and pediatrician, and this program came to be because there is a need. So many of you out there want to live better, want to live healthier, want to eat healthier, want to live in a place where you're not constantly in a state of stress and that you're just, surviving, treading water in life. But the problem is you don't have the means, the tools, the resource, the support, the accountability to really turn that into a reality. That's where well-being comes into play. So this program is a result of a need for so many people to truly live healthy. So a little background about myself and my team members. So I already mentioned I'm a dual board certified adult internist and pediatrician, and I'm the co-founder of Well-Being, a tribe planted with purpose. I've been practicing medicine now for, about 12 years, and I love every minute of it. But like I said, patients need more. I'm most recently an associate professor at USF, thanks to our arm in research, which you're going to hear about in a few moments. And prior to the onset of well-being, I was the creator and medical director of an employee and physician wellness program for Florida Medical Clinic. I'm a graduate of USF residency program, once again, combined internal medicine and pediatrics, and I served as the chief resident. I did my medical school training at Des Moines University, and I have a bachelor's in food science and human nutrition because I've always been extraordinarily passionate about nutrition. And what's so interesting, though, is what I teach, promote, educate today is light years away from what I learned in my undergraduate education, and you'll learn all about that throughout the program. So let's hear about our next team member. We have Kelly Matthew, who's my partner, my co-founder with me, and Kelly comes to the stage with so much. Much of her background is in employee wellness as well, and she's worked with just a number of types of dynamics and demographics. Her real skill set is in intrinsic health coaching, and those of you going through the program may have an opportunity to work with her, which is tremendous. She's also kind of the administrative glue that holds everything together. She is vital to keep everything afloat within well-being. Mindy Henson is our registered nurse. She joined Well-Being in 2019, and Mindy will be involved in educational programming, health coaching, and some other aspects within Well-Being. We've got Kelly Crow, who's our partner in licensed mental health counseling. We do a lot of cognitive and emotional training within well-being, and then because it's such a vital component of not just your well-being, but of course your success in this program and in life, we offer some additional workshops with Kelly Crow for you guys to engage in. And she's got over 20 years of experience. I refer her patients all the time because she's phenomenal. Our certified personal health fitness trainer is Gina Leffers, and she's been with us since 2019. What's really wonderful about Gina is she has a background in physical therapy. She worked as a physical therapy assistant. So for those of you who decide to join our program live, for her live fitness classes, she's going to help you adapt the exercises to your capabilities. And those of you who aren't going to be with us live, she will offer the training virtually. And same thing, she'll give you tips and opportunities on how to adapt. And whether your fitness level is, I'm already doing triathlons and running marathons, or I can barely walk around the block, our goal is to push you to do more than what you're doing today. And Gina's been a tremendous asset for that. Okay, well-being. What the heck are we? We're a 12-week integrative physician-led program. And what we hyper focus on in well-being is creating that somatic or physiologic awareness. What the heck is that? So my ultimate goal is for all of us to eat well, exercise, get our sleep, have positive relationships, not because it's sacrificial or not because we're chasing a number on a scale, but rather because intrinsically we just feel better. Okay, we focus on that ability to create somatic awareness to optimize metabolic health, cognitive health, emotional health, and yes, our physical health. And I want to camp out here for a second on this metabolic health because I really want to explain to you what this term means. A lot of times when we talk about metabolic health and metabolism, people jump right to my weight. Calories in, calories out, it dictates my body weight. And then on the other end of the spectrum, in the medical community, a lot of times when people talk about metabolic health, they think about diabetes, maybe pre-diabetes, but it's far more reaching than both of those. When we talk about your metabolic health, we're talking about ultimately every cellular pathway in the human body. We're talking about tissue growth, tissue repair. We're talking about ridding our bodies of toxins and wastes. We're talking about creating hormones. We're talking about immune function. And yes, we're talking about the energy input and output at the mitochondrial level, which creates adenosine triphosphate, which ultimately gives us the ability to walk, breathe, talk, sleep, do everything. But what's so important with this metabolic health is we are now recognizing this is where the majority of disease states begins. Whether we're talking about diabetes, pre-diabetes, metabolic syndrome, cardiovascular health, autoimmune disease, and even many forms of cancer. This is why I'm so passionate about this subject. This program is not meant to just help you lose weight, but rather live longer, live better, prevent and treat disease. All right, moving on, cognitive health. We want you to be cognitively sharper. We want to prevent diseases like Alzheimer's disease. We want to improve your emotional health, your well-being. We want to mitigate those signs and symptoms and feelings of depression and anxiety. And yes, we want you to be physically stronger and more vibrant. And our process offers two paths: a low carbohydrate or a more extreme version of that low carbohydrate, a ketogenic Mediterranean approach. And let me highlight the word Mediterranean approach. This is not a low carbohydrate or ketogenic plan that focuses on eating bacon and dairy. No, we hyper focus on this picture. Green things, plants. You will be eating 6 to 8 servings of something green every day. We hyper focus on those healthy fats, olive oil, salmon, avocado, nuts, seeds. We focus on adequate protein, not excessive protein. There's a big difference between a lot of ketogenic diet plans out there and what we teach, provide, okay? So let me get that straight. Okay, what sets us apart beyond the nutrition in which we teach? We teach the science of habit formation. No diet is good if we can't adopt it and sustain it. My years of doing this, my years of working with patients, we have to create a mechanism that is meaningful for you. We have to create both extrinsic and intrinsic motivation to help you achieve this. And we do that through cognitive behavioral training. We utilize technology in the forms of blood ketone meters, blood glucose meters, Apple Watch devices, fitness devices, so we can track heart rate. We use the technology that is accessible, but we teach you how to use it correctly. We create accountability and support. We need an army of help, right, to help us do this. That's why we call ourselves a tribe. My team, the mentoring, the teams that we put you in, if you so choose, all of this creates this mechanism to really foster long-term success. And we do the nutritional changes through a stepwise approach. We build up incrementally week to week to really make this whole process doable and sustainable. And it's interesting because always, people come and they just want to rip the whole thing off like a band-aid. I want to change my entire diet tomorrow. We have found that to not be super effective. We have found that incremental change yields far greater success. And time again, people come back and they're like, oh yeah, you were right. That was the most effective means for this. Okay, I talked about that this is a 12-week program. So let's talk about every week and what we're going to be discussing. So week 1, starting line measurements and identifying the ideal human diet. Starting line measurements. This is where we're going to see where we're starting from. What's our starting weight and blood pressure and waist circumference, maybe certain laboratory values. Where are we on day 1? Not just physically, but mentally, right? And then we're going to show you how that's going to transform throughout the process. And we connect this with identifying what the ideal human diet is, because there's so many differing opinions out there, what we should eat, what we should not eat. Well, what did we as humans eat for millions of years on planet Earth? What diet enabled us to be the dominant species on planet Earth? Should that not reveal to some degree what we should be eating today? Okay, next week 2, goal setting and gut healing foods. This is where when we really start tapping into that habit formation, utilizing extrinsic to bridge us to intrinsic motivation, goal setting. And we couple that with gut healing foods because believe it or not, the gut and the brain are intimately connected. And when we foster a place of growth and development within the gut, when we optimize that microbiome of the gut, we're going to teach you what that does and how that does truly connect to our emotional cognitive well-being. Week 3, we're going to talk about the mystery of our dietary guidelines, and we're going to talk about mastering detours. Once again, cognitive behavioral therapy. We're going to teach you how to use so many other healthy coping mechanisms other than food for when we're happy, sad, stressed, bored, fill in the blank, right? Detours are key. And this is, once again, we tap into those extrinsic motivators. We're going to debunk that good old-fashioned food pyramid. We're going to explain to you why it's not truly scientifically sound. We probably should create a new food pyramid, but we need to know why. Week 4, understanding nutritional ketosis. Once again, it is so vital you all truly understand the science behind all this. And once you understand the science of nutritional ketosis, number 1, how it's conducted, number 2, how it's done correctly, and number 3, the amazing health benefits that take place when we're in ketosis, it is super motivating. So we're going to talk about how nutritional ketosis reduces insulin resistance, how it shuts down blood glucose levels, how it affects hunger hormones so we're not starving all the time, how it affects DNA signaling pathways like mTOR and HDAC. We're going to talk about how it creates a process called autophagy, which gets rid of decrepit old cells that can wreak havoc within the human body. We're going to talk about how it can prevent most disease processes and absolutely promote longevity. Week 5, eat this, not that. Choosing your low carb or ketogenic Mediterranean eating plan. So this is where we really outline the differences between the two paths. This is where we identify your specific macronutrients based on your ideal body weight. So we're going to set carbohydrate, protein, and fat goals. Okay. This is where we kind of choose the path that's best for us based on our goals, based on our underlying health problems. That's week 5. Week 6, tracking and navigating our plan. This is when we take the plan and we truly put it into action in everyday life. How do I navigate restaurants and work events and just life in eating this way and maintaining it and sustaining it? Week 7, time restricted eating, fasting and alternate day eating. Fasting, time restricted eating, there's a lot of terminologies for this, a beautiful catalyst to really increase kind of our trajectory towards success. It is a keystone habit that I find many of our tribe members adopt and sustain long term. And we're going to teach you how to do this, why to do this, and how to do this safely. We're going to talk about week 8, moving for life. A lot of times people think about exercise and they have this kind of preconceived notion of it, but we're going to, I think, give you some new reasons why you should consider exercise, whether it be longevity, cognitive improvement, immune function, and we're going to teach you how to adopt and increase whatever level you're at currently with your exercise. We're going to help you go farther and farther. All right, and that's also, we're going to be starting our fitness classes after week 6 of the program. Okay, week 9, harness the power of sleep. We live in a society where the majority of us are sleep deprived, and we're going to teach you, first and foremost, why it's so important to sleep. Sleep is so dynamic. It is a restorative, rejuvenative process, and it's something we must put into our daily lives. And we're going to teach you sleep hygiene and techniques to improve your sleep quality and quantity. And then week 10, we're going to talk about cooking. We're going to provide you a cooking demo. If you're in our live class, we're going to do it live. If you're in our virtual class, we're going to do it virtually. You don't need to be a master chef to learn how to cook healthfully, deliciously, affordably, quickly. Week 11, food as medicine. And yes, we're going to be talking about food as medicine all along, but this week we really hyper-focus on some of that nutritional science, phytonutrients, phytochemicals, antioxidants. What are these? Why are they so powerful? Week 12, finish line measurements and how to transition to living this way lifelong. So it's really cool to see the transformation of the 12 weeks. And then secondly, we need to equip you to sustain this lifestyle indefinitely. And we're going to talk about different nuances about incrementally increasing carbohydrate intake, finding that sustainable place for you, and why taking on a position of leadership is so vital to guarantee your long-term success. Okay, each week we focus on new cognitive and emotional tools to arm all areas of wellness. This is way more than a nutritional program. So these mindfulness exercises are great detours that we're going to be talking about. I want all of us to get to a place where we're not treading water. We're not living on this constant treadmill in life. We're going to teach you the science of visual imagery, diaphragmatic breathing, which is a beautiful mechanism to learn how to actually control your autonomic nervous system, to promote and create feelings of relaxation, lower your blood pressure, lower your heart rate, help with sleep, progressive muscle relaxation, music as medicine, the art of altruism, and how when we think and care for somebody else, how it right sizes so much in our life, cognitive behavioral training, self-compassion. We are our own worst critic, and we learn how to be compassionate towards ourselves. That will yield much far less anxiety, depression. It will help connect stronger relationships with the people around us. We're going to teach you how to do that. And then how to eat mindfully. All right, once you're done with the 12 weeks, you have the opportunity to stay with us because once again, long-term behavior change requires long-term accountability. Okay, so we want you to stay connected through our rooted programming. The rooted programming is going to include things like ongoing continued education, opportunities to participate in other well-being sessions and events, access to our workshops, especially those kind of workshops that we have with our licensed mental health therapists, ongoing participation in our private Facebook community, opportunity to have discounted health coaching sessions. We'll share discounted recommended products with you that you'll get the opportunity to receive those discounted rates, and additional Q&A sessions with me. And then lastly, access to our alumni portal and forum on our website. We want you to be a tribe member with us for life. And what's so beautiful is, you know, we've been doing this program for a number of years now, and so many tribe members have been with us since day one. And then what happens is they turn into mentors and support and leaders for new tribe members, which is this like beautiful synergy for everybody. Okay. Why does a low carbohydrate and/or ketogenic approach help the human body? This is the research, my friends. So when we eat a low carbohydrate diet, we absolutely improve that metabolic and cardiovascular health. There's no greater nutritional plan to absolutely demolish diabetes. And we'll share some of our outcomes, but I mean, I have numerous patients who go through the program and their A1Cs are, 8, 9, 10, 11, and then they come crashing down 5, 6, at the end of the program. And that's without medication. We see radical reductions in blood pressure. We see dramatic improvements in abnormal lipid profiles. And we're going to touch on this a lot more about this lipid profile and the cholesterol screening. I'm going to provide you a lot more education to understanding what these lipid profiles really mean and the effects on triglycerides, the atherogenic of those lipid particles, right? Our goal is to reduce the risk of cardiovascular disease. And let's move on to neuro and cognitive health. So there's a lot of research in utilizing low carb ketogenic nutrition as an adjunctive therapy for dementia, Alzheimer's disease. It is amazing the cognitive benefits we can achieve through optimal nutrition. We see improvements in those chronic mood disorders, depression, anxiety, and of course, one of our primary missions is to help everyone get the sleep they need. Gut health, gastrointestinal health. We're going to improve reflux disease. We are going to radically improve fatty liver disease. Fatty liver disease is now the #1 cause of end-stage liver disease. And you do not get fatty liver disease from eating fat, but rather you get fatty liver disease from eating too many carbohydrates, which increase blood glucose levels, which then get transferred into triglycerides within the liver, create free fatty acids. That's what causes fatty liver disease. And the research shows that radically reducing carbohydrates will definitely help mitigate, treat, resolve fatty liver disease. And that is some of the research we are doing. And we have seen resolution of fatty liver disease in 12 weeks throughout the program. And one of the reasons I'm so passionate about this is we are seeing fatty liver disease in our pediatric patients. And this is treatable. Okay. And when we have fatty liver disease, that's a sign that we certainly have visceral fat around and of course within our organ systems. And that is an inflammatory igniter. And whether we're talking about inflammation to the endothelial lining of our blood vessels that contribute to cardiovascular disease, atherosclerosis, right? We're talking about inflammation that's going to contribute to just aches and pains within the body. The goal is to reduce inflammation. So that brings us to the next slide, chronic inflammation. So this is another area we're doing research. We're looking at specific inflammatory markers in a subject of our patients and how the change in diet reduces those inflammatory markers. And I'll tell you, just dropping insulin levels alone, we are going to reduce inflammatory markers. And time again, we have participants who go through the program and they come back and they say, I have less knee pain, my back pain is better. Our goal is to help our patients with autoimmune disease reduce the inflammation related to their autoimmune disease. So on that, I've already touched a little bit. Yes, we're conducting research because my mission is to really educate and move the medical community to understand and value this low carbohydrate and ketogenic nutrition. So we're partnering with Dom D'Agostino at USF and currently with Levels Health and utilizing continuous glucose monitoring, which is a device that is worn. Currently, Levels Health utilizes the Freestyle Libra, and it's a device that it's implanted into the skin and it's measuring continuous glucose levels through the interstitial glucose. And the whole point of this is to say, oh, if I can swipe my phone and see what my glucose is at any given moment, is that going to help create better behavior change to then provide more optimal metabolic outcomes? Once again, data is very motivating, especially for certain individuals. And when you can see that, wow, every time I eat rice, my glucose jumps 40 points, I'm probably going to be less inclined to eat the rice, as opposed to I just ate a dinner filled with broccoli and salmon and my glucose went up 7 points. I think I'm going to go ahead and choose the broccoli and salmon. So that's the whole point of this current research, and we have a lot more research that we're going to be conducting in the future. Super excited about sharing the outcomes of this data. All right, what are we seeing in well-being? What are we seeing as far as our outcomes? And once again, number of years now, consistent every single program cycle, we see about the same average weight loss. So for the ketogenic track, we see about 22 pounds of weight loss per tribe member. That equates to 9.4% of body weight. In our low carbohydrate track, we see about 14 pounds of body weight loss, which equates to about 6% body weight loss overall. So yes, the ketogenic track does tend to result in more significant weight loss. However, not one track is better than the other. What matters most is the track that's right for you. Now, when you compile all of our participants together, what we see is about an 8% total body weight loss, an average of 18 pounds per tribe member, 4 inches from the waistline, and a systolic blood pressure reduction of 8%. I share this slide to kind of just give you 2 examples of the many tribe members and their individual outcomes. So let's talk about Josh. He lost close to 75 pounds, which was a 22% reduction in his body weight. We saw an 8.25-inch reduction in his waist circumference. And that waist circumference is really important because it is a marker of that metabolic health that I'm talking about. And it associates with that visceral fat that I mentioned that is so pro-inflammatory and a much kind of higher risk instigator for cardiovascular disease and diabetes and dementia and many forms of cancer. His hemoglobin A1C went from 5.6 to 5.0. Hemoglobin A1C is a screening, diagnostic, prognostic tool for diabetes, and normal is 5.6 or less. Optimal is about 5.0 to 5.1. 5.7 to 6.4 is pre-diabetes, and 6.5 or higher is consistent with diabetes. And this gentleman had an 11% reduction. He had a normal A1C, but it moved to optimal. His triglycerides went from 194 to 142, which was a 27% reduction. Normal is 150 or less, but I will admit, optimal is 100 or less. And these triglycerides are really the instigator of, once again, that fatty liver disease, the atherogenicity of our LDL particles. So getting these triglyceride levels down is key. We saw a dramatic reduction in his blood pressure, 12% for his systolic and 25% for his diastolic. Let's talk about Susan, 20-pound weight loss, 10% body weight. We saw a dramatic reduction in her A1C. She had an A1C of 11.8. I'm not gonna lie, that's horrible. Without medication, because she said, no, I refuse to go on medication. I wanna see what this program can do for my diabetes. And she dropped it from 11.8 to 6.3. 6.3 is no longer consistent with diabetes, but rather pre-diabetes. She had a 47% reduction in that A1C in 12 weeks. Her fasting glucose went from 326 to 125, a 62% reduction. And you can see her blood pressure, 148 to 110 systolic. Same thing. She said, no, I refuse to go on medicine. I want to see what this can do. Now, the outcomes are variable for everyone, and not everyone who joins Well-Being needs to lose weight, okay? Not everyone who joins Well-Being needs to resolve their diabetes. Many of you might just say, listen, I'm healthy and I want to stay healthy. Beautiful. Exactly. I'm right there with you. All right, let's talk about our non-scale victories, because I think it's super important that we don't use the scale as our dictator of health and well-being. It is a metric that we absolutely pay attention to, for sure, but at the end of the day, it's not going to be the scale that's going to keep us sustainable. What's going to keep us sustainable is truly living and feeling better in life. So here we have, the chronic, I just don't feel good, my stomach bothers me all the time, I'm always bloated, and guess what? This person said, not anymore. We see the comments about this cognitive enhancement. I'm just sharper, I focus better. The reduction in the headaches. I mean, there's research, ketogenic diets is a great treatment for migraine headaches. The relationship piece, the tribal piece, people get connected, and it's so wonderful to see these ongoing sustainable relationships take place. The self-image. I mean, to me, this is one of my most favorites. Like when people walk away and they're like, I can walk with my head higher. I can talk and project my voice more loudly because I believe in myself and I feel good about myself. No greater benefit than that. Reduction in medications. And this is a big one because a lot of people are spending a lot of money on medications, or we also have to worry about the side effects of medications. And when we can reduce the number of medications, that's a huge investment, both financially and, life-wise, to commit to. Hope for the future, and this is a big one. This is one I feel really, really proud of, because the end of the 12 weeks, a lot of times, most of the time, people say, I now know what to do. I have the tools, I have the experience, I have the support. I'm not fearful that I'm going to go back to my old ways, because if I slip up for a minute, I know how to rebound, I know how to get back on track. We think it's so important that you recognize that there is a wake beyond you and you improving your health and wellness. Now, you're going to get to see that directly with your family members, your coworkers, your friends. They're going to start noticing what you're doing, and they're going to start asking some questions, and you're going to influence them. And what's so neat is we'll have, once again, one family member join, and then the spouse may participate on the periphery, and before you know it, we've got 100 pounds lost within one family member, and only one person is actually going through the process. But we also want to take it beyond you and your direct family. We want you to understand that you're changing the world, the community around you. So for every one of you who goes through the program and has some form of success, whether it's weight loss, whether it's a non-scale victory, whether it's you just stayed with us for the 12 weeks, I will make a donation on your behalf to chosen organizations that you all get to vote on. And thus far, I've donated $14,000 thanks to our tribe members' commitment and success. And this next slide here shows you all the many of organizations that we've connected with, all thanks to our tribe members. So please, we want you to not only improve your health, but we want you to help us make a difference in our community. So, sounds great, right? I'd be lying if I said all you need to do is register and magic is going to happen. That's not the way life works. Nothing in life works that way. Anything worth having in life takes time, commitment, effort, sacrifice. Your health is no exception. So if you choose to join Well-Being and you feel like you're ready to join Well-Being, this is what I ask of you in return. You have to commit to the process. There are so many excuses why we can't do this. I've heard them all. We have to let them go. We have to create detours and workarounds to the excuses. Next, you have to commit to the weekly sessions, whether you come live or you commit virtually. Set the time aside. Unless there's a hurricane or you're vomiting, you're going to commit to your weekly sessions. Engage in those weekly sessions. Do not multitask. Truly be present to really learn the information. Access your notes. You're going to be given these detailed notes to go along with the sessions. Underline, highlight, write down your questions, right? Then when you have those questions, when we do our additional Q&A sessions, you ask them. Utilize the Facebook as a means to ask questions. There's so many opportunities for you to get more information. You're going to have weekly action items, nutritional, cognitive. We ask that you commit to those weekly action items. Don't just haze over them. Find a means of support and accountability. And if you want us to find a teammate for you, we are happy to do that. You reach out to Kelly Matthew and we will find a teammate for you. We're going to give you the option to join a team. I encourage you to do so. And then lastly, you need to communicate with your medical provider if you go through this program, especially if you have diabetes or hypertension, because you're going to need to make some changes with your medication. Please know that I am not taking the place of your physician or healthcare provider. Okay, I'm a means of education, but I am not your physician. So you have to stay in contact with your healthcare provider. Okay, so let's talk about the differences between our live programming and our virtual programming. So our live program is held Tuesday evenings at our Wiregrass campus located off of Bruce B. Downs Boulevard. And those classes are 6 to 7:30 p.m. Now, if you can't be present for a live class and you've registered for the live class, you always get the option to receive the virtual class. So you never have to miss, okay? Those of you who join us live, you will have the opportunity to join with myself and the team members for pre and post program measurements. We, of course, have our 12 live classes, which are interactive and dynamic. You will have access to the downloadable nutritional resource guide, the weekly program notes, sample meal planning, and then we will have additional Zoom sessions with both our team members for Q&As, in addition to those live classes, as well as mentoring sessions with some of our tribe alum. And then, of course, private access to our private Facebook group. You will also receive in the live class a digital food scale, access to 6 live fitness classes with Gina on Saturday mornings in Orlando Lakes location, individualized health coaching, that's included, a live grocery store tour, a live cooking demonstration, those additional mindfulness workshops, and the opportunity for some blood keto monitoring checks within the live classes. Okay, and that cost is $5.99. For those of you who choose to do this virtually, because you can be anywhere and do well-being, you will get access to our 12 virtual recorded sessions, all taught by me. And this gives you the opportunity to customize when you watch them, and the opportunity to watch them in extensive time, or if you want to repeat the session, you can certainly do that. So you'll get those 12 sessions. Then we will ask that you and we give you an option to go onto our website through our document hub. We have a back side of the website that's all for our participants going through the program. That's a whole nother kind of mechanism for connection and education. And through the document hub, you'll be able to complete your pre and post program measurements. You will have the access to those additional live Zoom sessions, the Q&A sessions, the mentoring sessions. You will also have access to the nutritional resource guides, those weekly notes that you can use to accompany the webinars. You will have a virtual grocery store tour that's just for you guys, the virtual cooking demo, downloadable sample meal plans, access to the private Facebook community group that only tribe members get access to, and then virtual fitness classes and virtual mindfulness workshops as well. And that cost is $2.99. So if you're interested in registering, and if you have questions, you can reach out to Kelly Matthew. Her email address is right here, kelly@yourwellbeingtribe.com. That's kelly@yourwellbeingtribe.com. I encourage you to visit our website, www.yourwellbeingtribe.com, and you can access more information, more of our research, our program outcomes there. You can certainly register for the program right then and there. We don't accept insurance. If you have health savings accounts, most of the time you can be reimbursed through your health savings accounts. If you want to see if your insurance will reimburse you, by all means, you can absolutely do that, but we don't bill insurance, okay? Also, if there's immediate household family members that want to do the program with you, we offer discounted rates for you guys. So please reach out to Kelly to learn the details on that, okay? Because you'll need a personalized code in order to register. All right, so please reach out to us if you have any questions. Once again, our website, contact number for Kelly Matthew, 813-785-9673, her address. And I encourage you to follow us on our social media at Dr. Allison Hull on Instagram. Follow me on Instagram, and then on Facebook, follow through at A Tribe Planted with Purpose. Follow us, like us, do all that fun stuff. It's another resource to get education and inspiration at the very least. So thank you guys so very much. And, as this slide says, our vision is this: ignite the purpose of one to transform the well-being of many. And just you wait for what will happen, how your life is going to change, and how you are going to change the lives around you. So I'm so grateful that you took this time to learn what we're all about, and just please reach out to us if you have any questions. Thank you so much, and we look forward to having you being a part of our tribe.